Hello and welcome everybody. My name is Melanie Dizon. I'm the Director of Education and Research at the Phinney Foundation. And today we are here for a webinar on health disparities and Parkinson's, bridging the gap between rural and urban. I'm gonna go through a couple of little housekeeping things real quick, and then I'm gonna pass it over to Sonia to get started. Right now I'm gonna enable the live transcript. So if you are, you could see it on the bottom of your screen. And if you want to not see it, then you can click on, there's a little thing at the bottom of your screen that says live transcript. There's a little arrow that you can click and then say hide subtitles. So you don't have to see it the whole time if you don't want. If you want to say hello, we would love to say hello to you and let us know where you're from. So you click the little chat box at the bottom, and a little pop-up will pop up to the right, and you can click your message to us and just say hello and where you're from, and no pressure if you don't want to. We just want to make sure there's somebody actually listening to us and can hear us. So you can be the first. There's a little blue thing at the bottom. You can click panelists if you want all of us on. Hello, hi Anne from New Hampshire. Okay, we are live. That is good to know. If at some point during the session you want to chat to everybody that is listening and watching, the little arrow, you click that, and then you click all panelists or panelists and attendees, and then everybody watching will see what you have to say. That's totally great. Sometimes people share really, really excellent information in the chat, so feel free to do that. If you only want the panelists to see your question or somebody in particular, just click panelists, or I think you might be able to pick just our name, and then you can just directly message us and nobody will see it. A couple of other things, we are going to provide the recording for the video, an audio recording, and a transcript. So if you have to leave early, no worries, we will have that for you. We'll have it for you in the next, probably early next week, and we'll mail it, email it to you. If you have any questions about the Davis Phinney Foundation in particular, you can just email us at blog@dpf.org, and we will be in here. If people start talking about links or they start talking about a research study or something else, be sure that we will provide the link in the chat if we can get it right away. And if we can't get it right away and we need someone to help us find out where it is, we will find it, and then we will include it in the links when we send out an email. So we're going to save everything. If you miss something, don't worry about it. We're going to have it for you. All right, I think that's it. I'm going to hand it over to Sonia. Sonia is a part of our board of directors. I was about to say science advisory board, our board of directors. She does a lot of our moderating. We love having her here, and we think it's going to be a super great discussion. So Sonia, take it away.
Thank you, Mel. Good afternoon, I guess I was going to say, depending on what part of the world you're in. My name is Dr. Sonia Mather. I'm a family physician and Parkinson's patient, having been diagnosed well over 21 years ago, 22 almost. I have the privilege, as Mel said, of serving on the board of directors for Davis Phinney's Foundation, and I have the pleasure of being your moderator today. So today, as part of our Health Disparities in Parkinson's series, we're going to be addressing the concept of the urban and rural divide, the disparity between the care and outreach that patients with Parkinson's disease face, depending on where they live. And although this is somewhat the case, there is also another side to this issue where those concerns are not as polarized as one might think, and there are, in fact, some shared experiences. To help us explore this topic today, I will be joined by 4 remarkable women who work hard to support our Parkinson's community. So first, I'd like to welcome Wendy Lewis. Wendy is the CEO of the Parkinson Council in Philadelphia. She has a long, successful career in working with nonprofits, having received her master's in nonprofit leadership, and has been with the Parkinson Council since 2010. Welcome, Wendy.
Thank you, Sonia.
And next is Amber Winter. Amber is Executive Director for Parkinson's Nebraska. Although relatively new to her current position and as a sole staff member, which I still can't get over, she brings us wealth of knowledge and a degree in nonprofit management. Thank you, Amber, for joining us today.
Thank you, Sonia.
And also with us today is Holly Chamoff, Executive Director for Parkinson's Research of Oregon. Her involvement with PD really extends beyond the great work she's done with her community. She serves as a member of the Unified Parkinson's Advocacy Council, which focuses on really advancing policy changes for all of us with Parkinson's disease. So thank you, Holly, for joining us as well.
Glad to be here. Thank you.
And last to be introduced, but certainly not least, is Kathleen Christ. Executive Director of the Houston Parkinson Society. With her degrees in social work and her extensive experience, she's been responsible for creating and implementing many service initiatives, support groups, and educational programs. We're so glad you could join us today, Kathleen.
Thank you, and thank you for having me.
So it's a real pleasure to be speaking with you all about this topic in the field of health disparity. As I mentioned, we sort of talk about the existence of this urban-rural divide in Parkinson's care, or actually medical care in general, and that divide is real in a lot of ways. I mean, there is a disparity between retention of medical professionals, access to care, access to technological advances, the influence that different regions may play or have in policy changes, and so forth. But there are also many similarities, particularly as we look into certain communities within the urban setting. So I'd like to start off today by asking each one of you a question. And maybe you could share a little bit about the community you serve and the top 1 or 2 issues that you face when trying to provide equitable and comprehensive care to those in your regional community. I'd like to start with Amber. Amber, when we spoke prior to this webinar, you mentioned that you're kind of doing this from the beginning, getting to know what services are needed, what community outreach should look like in your area. So what have you found challenging?
So here in Nebraska, well, our organization, Parkinson's Nebraska, serves the whole state. So we serve both people living in the urban setting here in Omaha and in Lincoln, as well as people in rural communities all across the state. We see some similarities with, well, obviously the type of services that people need access to, support groups, exercise classes, access to movement disorder specialists. One of our biggest challenges is really reaching out to those rural communities and getting them connected with the statewide network. We have found that one of our best ways to work through that is through partnerships with people all over the state. As an organization and as a single employee, there's only so much capacity that I have. So that in and of itself is a big challenge that we face. And so I find myself working really closely with people here in Omaha, really great relationships to be able to connect people with resources, as well as leveraging national resources, statewide resources, and building relationships with people in outer parts of our state, because we can't do everything. So we really do rely on people all across the state to be able to learn how they can make an impact and really provide them with those resources to help them.
So you provide resources to people that you partner with in the community. Are there specific people that you do tend to reach out to, like support groups, or are they sort of individuals involved with Parkinson Nebraska?
Yeah, so we, the type of people that we reach out to, we're really focused on the person with Parkinson's. So what does that person with Parkinson's in each community need? And how can we help build wellness programs in communities that, either don't have all the aspects of wellness, like therapy, access to a physician, support groups, and education. So we do work a lot with, if there's a support group that maybe we have a relationship with, really strengthening that relationship and then using their information and their knowledge on their local community, because they're the experts. We're not the expert of Norfolk, Nebraska, for example. So we really do rely on the exercise professionals, the physicians, the speech therapists that work there, and the support group leaders to help us know who has Parkinson's, what does their community look like, specific to their area, and what do they need? And then what can we do and what resources can we connect them with via national, via providing funding for them to help their communities grow, but really relying on the professionals as well as the people with Parkinson's that we develop relationships with to tell us what they need. And we work with whatever resources we have available to us to connect them to what they particularly need. That's a big part, I think, and really important when you're having this conversation is, like you mentioned, even within an urban community, there are multiple smaller communities within an urban setting that might have certain disparities that they face. For example, here we are working towards a new program for people who don't speak English as a primary language. And English is my primary language, and I don't have access. I don't know any other languages. So by partnering with other community members, other organizations that do have access to that can provide something that we can't provide, we're able to really make a bigger difference and reach more people that way.
For sure. And Wendy, I know that I'd like to ask you specifically about that, about the challenges you faced, because recently, I mean, the issue of inequity has come into focus in our world, and rightly so, the way we look at the world. Inequity is real, it's pervasive, and it affects all areas of healthcare, including Parkinson's care. And so, for example, I believe when we spoke before, you mentioned that the Houston area population is about 40% Black, but the only 8% make up, I think you said, of those visiting Parkinson's institutions. So I know that, sorry, I was just gonna say, I know that all aspects of our PD community, you know, the people of color, Indigenous, Black communities have not been traditionally reached. So why is that, and what challenges do you have to overcome to get there?
Thank you, Sonia. So we actually, in the Philadelphia area, are rich in resources in terms of experts in the field of Parkinson's. We have two major centers at Jefferson and Penn, one across the river at Cooper in New Jersey. And then we have a center in Delaware as well that deals specifically with people with Parkinson's. So our region is really rich with experts. The challenge, however, has been accessing, having communities of color access that care. And a lot of it has to do with education, outreach to those communities. A lot of communities of color are dealing with other issues that take, prevalence and a priority. If you've got a community of color that's dealing with issues, just to say COVID, right now you see that happening in a lot of communities across the countries where people of color are usually probably the first or the most hardest hit, and are the last to actually have access to the vaccine. Similar in Philadelphia. One of the things I think that is unique about our region, though, is that the centers recognize that we need to do more, and despite the competition that they have with each other, decided to come together to work collaboratively to address those issues. So there's a lot of outreach that we as a group, a collaborative group called Diversity PD, are doing to educate community health workers, because I think that's where it's going to start, about Parkinson's. They are seeing their clients are dealing with, I said, lots of issues from obesity to diabetes, heart disease. So Parkinson's falls down in that list of things to take care of. So we actually have done a really, I think, try to do a better job than we've done previously to reach communities of color. But it doesn't mean that all institutions have to stop addressing the systemic reasons why this has happened in our community. Yeah, the Philadelphia region, we're talking 44% of the population in Philadelphia are African American, yet of the clients that visit those centers in the metropolitan area, 8% are African American, which is astounding. Again, we have to do a better job of educating people who are reaching and working with those communities of color. And then also the biggest issue that we face is trust in our community. We recently had a huge fiasco rolling out the vaccine, and it's something that I think the city is trying to rectify by ensuring that the experts who know, the docs who know about how to deal with infectious diseases, reaching communities of color, know and have the built-in trust are the frontline staff to help to initiate and implement the vaccine program in the city. So trust is a major issue, and I think that across the board, just as a national initiative, I think that the country has to do a better job in reaching communities of color when it comes to anything having to do with working with big institutions to provide care.
Yeah, I think you're right. I mean, I think it's a hugely complex issue. And, there's not going to be a short-term solution to a long-term problem, but we
Exactly.
have to definitely work towards it. Has anyone else had issues with reaching certain underserved communities? I mean, they don't necessarily have to be communities of color. They can be socioeconomic issues, distance issues, other basically underserviced communities in your area. Holly or Kathleen?
Well, I can speak for what's happening kind of here in the Houston area. And when I say Houston area, we serve the 8-county region, which is somewhere around maybe 6 million people. So it's a big area. It's pretty geographically spread out. There, we don't have mass transit systems that are, helpful in terms of people and access. Houston's also very richly diverse culturally, and so within populations of our community, access tends to be a problem. Like Wendy mentioned, we too are very fortunate to have wonderful movement disorder clinics. We have a PADRAC here with the VA. We also have 4 different movement disorder clinics and upwards of 15 movement disorder specialists just located right here in our Houston area. But we also find that folks in the outlying area don't have the same access to care and experience barriers, not only just in terms of physical access to it, but also in some of the in just some of the support that they have from their healthcare professionals in those areas. As well as some cultural barriers that they're facing, just in terms of stigma, trust, and shame from within, that type of thing. And so, so certainly there's a lot of work that needs to be done, kind of in the outreach efforts to groups beyond, groups that don't have kind of the same accessibility or the same access that other populations have.
And have you brainstormed? I mean, are there specific things that you're trying to do as an organization in order to reach out to those individuals or those communities?
For us, one of the things that we're really trying to focus on is a lot in terms of education. So trying to help folks, figuring out education that is something that can be done across, no matter, that kind of takes into consideration, I should say, cultural issues, cultural barriers, cultural norms, takes into consideration, urban versus rural, location, education status, income levels. So we're really trying to figure out ways that we can communicate that help folks understand better, what's Parkinson's and what's aging. What is it that we can, what is it that we can tell you in terms of symptoms, that we can start dialogue, that we can start getting resources to you that don't have, whether it's mental health issues, whether it's cognitive issues, some of those things that really carry a little bit more stigma associated with it, that create, barriers for people to want to reach out for help. So we're really trying to focus on how can we best educate, spread the word about Parkinson's. What is it that we can do, even in terms of providers? I mean, I think, one of the things we've discussed internally here is kind of how the UPDRS, which is, that Unified Parkinson's Disease Rating Scale, is not very culturally competent. It's also, for folks who have a higher education level. So the part where you have to self-assess, or the part where as the interviewer, you're assessing someone else, we're looking at how can you adequately or appropriately assess aspects that influence someone's quality of life and get them connected to resources they need when the tools that we're using aren't really even adequate or appropriate, just on face value there.
No, you're absolutely right. There's so many nuances to this issue. I mean, culturally, there's so many nuances. I mean, I know from my East Indian background that my family probably took it a little differently than they say someone else's, but yeah, it's a hard road to navigate, but it's necessary. You know, as our world becomes, our countries become more and more multicultural, we have to not let certain communities slip. You know, they deserve just as they deserve the same level of healthcare and access to healthcare as anyone else. So I'm glad that you're all working on that. Holly, did you want to add something?
Well, I was just going to kind of underscore the rural issues. For a lot of our state, the rural areas are really not densely populated at all. Like the county seat isn't even a large town. And so we run into challenges where when we talk about providers and bringing providers together, for some of our counties, there's not a neurologist, let alone a movement disorder specialist, counties apart. And so this creates, for many people, this really significant burden of traveling to get medical care, which is compounded when we, as an organization and as a community, talk about the importance of specialty care for your Parkinson's disease. When some people are struggling just to get a primary care doctor that is willing to work with them to treat their Parkinson's. So I think that we can't leave behind really some basic care and the need for really some basic care within many of our counties across the country here.
Right. And I mean, diagnosis itself is out of reach for a lot of people to even come in. Yeah.
It really is. You know, one of the things that we've been pleased to be a part of is our local Center of Excellence does do some outreach to primary care providers and provide training for them on Parkinson's disease. So we leverage our local support groups to help identify who the docs are in the communities and try to use the patient population to encourage the medical population to rise up and do just a little bit better.
Holly, that access to care and the distance that some of your constituents have to travel kind of reminds me of, well, I guess if any one good thing came out of this pandemic, is that we've seen sort of the rapid progression in the development of internet resources and telemedicine. And that really has come along a far way in a very short period of time. You know, a variety of support groups and educational groups, exercise classes, and more. And one thing I remember you saying at our prep call was that you thought that this would be the kind of, you know, great leveler or equalizer, which makes sense to me. I would think the same thing, but in reality, you said it wasn't so much. Is that right?
Yeah. So just to elaborate on that, the hope that we had and the expectation was that with all the wonderful virtual opportunities for people, that these geographic barriers would no longer be what kept people from having access to an exercise class or their support group or even an appointment with a movement disorder specialist. However, broadband access, Oregon is 36th in the country. And this affects a great portion of our geography. We have counties that there's nobody in the county that has high-speed internet access. The whole, you know, it just doesn't exist. And so this idea that we were going to see people from our outlying regions being able to engage much more than when we're live and in person just really didn't transpire for us, at least not here in the Northwest. Having everything to do, I believe, with internet access.
Amber, is it the same for you in Nebraska?
Yes, I would echo a lot of what Holly just mentioned on the geographic barriers that people out in central and western parts of Nebraska face are very real. We are lucky here in Omaha to have the University of Nebraska Medical Center and Nebraska Medicine. We have a comprehensive multidisciplinary Parkinson's disease clinic with some world-renowned movement disorder specialists, but they're all here in Omaha. And so when you look out to central and western parts of Nebraska, you are seeing a lot of places don't even have neurologists, or if they do, they're traveling between many towns. And so people are going to their primary care physicians or their family physicians with symptoms that oftentimes, we see here a lot that people are getting, if they're even getting diagnosed, they're getting diagnosed really late in the disease progression, because they're not catching those more subtle non-motor symptoms. So by the time they are diagnosed, it's, they've really progressed quite a lot. So we do see that a lot. And we have really been focused on outreach to rural communities. That's just been a really big part of our strategy over the last 2 years, and we've made really great progress. However, there was definitely, we also were very excited for Zoom and had all these great ideas for connecting groups and setting them up on Zoom calls, and huge oversight on our part with the hundreds of people that across our state that no matter how great their internet is, no matter how motivated they, or how great their computer is, how motivated they are to learn, there's a lot of people who just don't have access to internet, or quality internet, where if we were talking right now, it'd be super choppy and bouncy, and I would probably exit out of that as well. So we have been trying to determine what's the next step to that, internal, that statewide structure, that infrastructure. And I think for us, that's really going to be, and probably every state facing this is going to be, we're not the only group that's facing these issues. There's schools that are facing these issues during COVID, other types of diseases or medical providers. So while Zoom and online and telehealth absolutely has helped a lot of us reach a lot more people, it's also thankfully brought to our attention a huge gap in meeting the needs of people without internet access. So I'm grateful for that, though, because before all of this, we weren't even thinking about that as a barrier. So now at least we know, and we can try and partner and find ways to meet that.
No, I think you're right. Identifying the barrier is the first step. But it must be frustrating because, especially when you're talking about large geographical distances, that would be prime to be able to have a really good telemedicine network that people could access. It would be revolutionary for a lot of people. How's Philadelphia and Houston?
Oh, I was going to say, I might add that one of the interesting things is Texas had very limited laws related to telehealth and telemedicine. And so the onset of COVID really forced this issue. So all of these kind of excuses that the Texas legislature had about why we couldn't have telehealth or telemedicine really had to be, there was a lot of pushback, and they had to allow, and make accommodations for folks because people, when everything was, a shutdown as things got here in Texas, that they were able to, that people had access regardless, whether it was primary care or specialty physicians. But this whole pandemic really did kind of open some of the gates and kind of push that forward a little bit here in the state of Texas, because it's very limited. There were a lot of restrictions, a whole lot of excuses why it couldn't happen. And what we have learned, because even though we do have upwards of 15 movement disorder specialists here, we have people coming from Mexico and Louisiana and Oklahoma and all across the state of Texas. But even just here, from one end of our service area to the other could be, a 2-hour drive. But getting into the medical center, which is where the majority of these folks are housed, there's a lot of traffic. And if anyone's ever been to Houston, you are well aware of our traffic situation. It's expensive to park. It's difficult to navigate. We now have light rail down in the medical center, which has been, kind of an ongoing issue for people to navigate. And so so this has really given people an opportunity to have access in ways that I don't think many of us thought we would see, as soon as we did.
It's interesting how the pandemic kind of cut a lot of red tape very quickly. We see that
sure did, yes.
Collaboration between scientists and the development of the vaccine, particularly, issues like you were saying about the telemedicine. Wendy, how are things in your neck of the woods?
So Philadelphia is the birthplace and headquarters of Comcast,
Okay.
and Comcast has, I think, in the last maybe 10 years, has tried to make it more affordable for access to internet access, to broadband internet. There are places around the city that students are set up for students and designed for students to go to do work. Um, I do know that for some families, even the small fee that is sometimes required, I think it's like $10 a month, it's still a stretch for a lot of families who are facing issues like food insecurity or housing. A lot of families who, not only are they unable to afford access, but they don't have the technology. Even if they, had a place to go, they won't necessarily have the technology to actually initiate access. So, Philadelphia is unique in that way. One of the things that I think, just a little bit of background about our organization, is that even though we are an organization that has been around since 1987, and one of our founders is one of the three co-founders of Comcast, we still have some challenges in helping and navigating that relationship with Comcast to ensure that they recognize some of the barriers associated with people living with a disability who may have really a tough time accessing care. Again, they're doing what they can do. Everybody wants a piece of what they are able to provide financially, and so I think one of the biggest for us as an organization is to continue to identify access points that partnerships that businesses can do with local nonprofits and work in a collaborative fashion to ensure the local families have those needs met. I may have mentioned this before that I think Amber mentioned the fact that neighborhood to neighborhood is very different. If you've been to Philly, our neighborhoods are very different. People are very loyal to their specific neighborhoods. Folks who live in the North Philly area may not want to travel to Center City to see a movement disorder specialist. Maybe they just want to go to a neurologist nearby. The neurologist may not be as equipped to be able to provide the comprehensive care, but there's access, there's something. So people are very loyal to their neighborhoods. They're very loyal to their providers. And some folks may not even have ventured even farther than their neighborhood for pretty much all their care. Everything that they may access is right there. So I think that having big institutions do that outreach, as I mentioned before, to create a level of trust, to be able to, say, this is what we can do for you. And this is, not only are we talking about people who are living in, Philadelphia is a pretty poor neighborhoods. And then we have an area that has pretty wealthy neighborhoods. So it's pretty segregated racially and in terms of economically. And so we've got to work really closely with our business and our business sectors to help identify ways to partner with community-based organizations. We've got folks who live 2 miles away from less than 5 miles away from a big service center in Philadelphia, where you'll see a difference of life expectancy of 7 years. It's a difference within 5 miles. So, it's a lot of work to be done in our region. We are a big metropolitan area. We're a regional organization. So again, we work very closely with those across the river, both in Delaware and in New Jersey. So it's a big thing to handle and manage, but I think that there's a lot of commitment from those providers to ensure that that we're not leaving folks behind in care.
It's so interesting. You all sort of travel in this very complicated world in some ways, because it's not just about identifying, say there's not enough movement disorder specialists. Increasing access to them doesn't necessarily solve the problem, because there's all sorts of issues that led to the problem in the first place that you have to solve along the way. So it's even like you're saying, you put educational classes up on the internet and you think that would reach more people, but yet there's barriers to get them even to be able to log on or to afford to log on, which are real life problems and things that we have to look at in order to really truly get sort of more equity in terms of access to care. One of the questions that someone who's watching put forth is, they said, what lasting value, if any, do you see for both rural communities and minority communities resulting from the virtual forums that have been developed to deal with the limitations required by COVID? I guess beyond the as long as they have internet access, I guess. Has that been a successful way to reach people for any of you?
Well, just from a Houston perspective, I can just say that prior to COVID, we did nothing virtually. And so now that we have virtual programs, which clearly people have been very receptive to, we actually have a much greater level of participation from the outlying counties that we serve. So those areas that maybe we didn't have programs in, we were beginning some outreach pre-COVID. We now will continue those virtual programs so that we're reaching people. We're also doing support groups virtually. We're doing educational programs virtually. We've had the opportunity to serve people kind of in that are coming to Houston for various reasons, but don't necessarily live here, but consider this kind of their home base. So we've been able to serve them in ways that we hadn't prior. And I think that was pretty extraordinary for us. It was not something that we necessarily were expecting. We had maybe a little bit different experience than like Holly and Amber maybe have had in terms of internet access. We also had, interestingly, a number of kind of multi-generational homes that have said because their grandchildren have access to internet and have now been given devices that they use for that they use for schools, that they can join in on things and see their doctors using that technology just kind of on off school hours and things. So we've tried to, we've been able to implement some evenings, some weekends, some other things that we weren't doing that this technology gave us the opportunity, or that this kind of forced use of technology gave us the opportunity to do.
That's great. Holly?
I think we're going to end up in some kind of a hybrid after COVID, where we will continue to be offering some of our services virtually, but we'll be moving back to as much as we can that we're offering live. With the rural outreach that we had initiated in 2019 and we're continuing rolling out into 20, we'd had really some great impact with education out in communities, bringing staff, local experts, as well as folks from our regional medical center out to talk and provide education on Parkinson's disease. What we learned was that many of those people that got engaged because of that outreach didn't continue their engagement in a virtual setting. And whether that's because there hadn't been enough time to really forge those relationships or not, but for us, it really highlighted that boots on the ground and being present in a community and having the respect. And Wendy talked about this trust level. Trust is a real big issue in an urban-rural divide. Certainly here in Oregon, it is something that we read a lot about, that there is great mistrust between folks who don't live in our urban settings, who look to our more urban communities as having all the resources, and how there's just great disparity there. So it is going to require us to be back out in the field again as soon as we're safe to do so.
Yeah, I mean, virtual is tremendously helpful sometimes, but there's nothing that kind of replaces that rapport that you feel when you're sort of one-on-one with somebody. Amber, you're going to do sort of a hybrid as well then?
Yes. Yeah, absolutely. So before 2019, we kind of started at the same time, really being intentional about rural outreach. there was very, very limited services available. We've actually in the last 2 years quadrupled the amount of exercise classes, support groups, et cetera, available in rural communities. So through Zoom, we do have this issue of a barrier issue of access to internet. However, we have seen a lot more people, I guess people in central Nebraska and western Nebraska have been so underserved for so long that they are so eager to get access to these. There are boots on the ground just organically who have been really wanting for a long time and just really needing to be that leader in their community, and being able to provide, you know, like this webinar, for example, out to those communities. It's the local support groups that are sharing this information. So there is a little bit of, you know, we're really trying to work with the local leaders who have that trust there and providing them with a lot of resources, connecting them with national resources. We're able to get movement disorder specialists to do webinars with support groups in Alliance who have never spoken with a movement disorder specialist before. So as much as there is that, you know, internet access issue, we have seen a really great welcoming response from people in central and western Nebraska. And that's been really, really great to see. We do plan, when COVID started, you know, our first challenge was, how do we transition everything online? What does that look like? And I think the next step of this is going to be, how do we transition from virtual to hybrid? Because it's been so successful. We have people tuning in to programs from like a small town, Beatrice, who join our UNMC support group, who never had access to that support group before COVID because it was all in person. So to be able to offer things in person as well as still maintain the importance of that online kind of hybrid, that's kind of the next step that we're going to be approaching with professionals as in-person classes resume, is how can we keep offering this to these communities outside of here while also, you know, building that in-person local community as well.
Right. That kind of ties into the next question that someone has submitted, and they said, or they're asking, what can a person with Parkinson's like me who has access to resources and information and treatment and support do to reach out to those who don't? Does anyone have any ideas about that?
I guess the thing I would say is how much do they know about their community? I mean, get to know what the needs are in the community. If you have access and you have resources, if you have knowledge, if you have time and expertise that you could share, you know, find a way to volunteer that, to create a sense of community, even if it's virtually. I think that's one of the biggest challenges that the COVID has seen, you know, that a lot of folks living with Parkinson's has experienced, because Parkinson's is already an isolating disease. Anything that you could do to create community and build awareness and build visibility about what's available, I think you should take that opportunity to do that. So I would say to that person is to connect with those health professionals. I mean, I'm sure they would love to have somebody to come in and take on a role of a support group leader, or somebody who could facilitate a gathering of some sort where people can share ideas and tools and thoughts. I think that would be just a huge way to give back to the community, and also you can actually get something for yourself as well. So it's a, you know, very a relationship that is a give and take. But I think that if you have all of those things and you have the time and you have the expertise and you have the energy to do that, you know, reach out and to those experts and ask, like, what can I do to give back to help support the work that you do? So that's kind of what I would recommend.
Yeah, and that whole concept of reaching out is so important, particularly now. As you said, Parkinson's is, you tend to sometimes socially isolate yourself because of the disease. And then on top of that, the COVID pandemic has not helped in that way. Does anyone else have some suggestions for the person?
Well, to follow on to what Wendy was just saying, I think that for those that they're getting really good care and they have the resources, one of the things that any of us can do is to just be very public about what we're dealing with and what you're living with. I think that anything that you do to help raise the profile of Parkinson's disease and to help normalize the experience and other people to appreciate and understand that there's this great range of experiences is only going to have ripple effects throughout the community. And you may be living in a resource-rich town, but you don't know who knows somebody who's living much farther away. We all have these impacts that are unknown until you change somebody's life just by sharing your story.
Absolutely.
I could kind of add on that as well, is to be really intentional with your time and who you're reaching out to. Find out who are those therapists in the town over from you who maybe doesn't have a support group. Who are those therapists that might be trained in a Parkinson's specific program that has access to that community in that town, and work with them to identify what those needs are and maybe start a support group, or if they know someone with Parkinson's, talk with them, start a relationship with that person so that they can build a support group. Here in Nebraska, we have a group in Norfolk, which is about 100 miles north of Omaha, and they have people from O'Neill, which is another even smaller town, maybe about an hour west of there. And those people in O'Neill have been traveling to Norfolk for services, and they just reached out to me recently for help with, well, how can we just get something going in O'Neill? We have stuff here in Norfolk. There's no reason for them to drive all the way here if we could just get them set up with resources and meet the needs of their community. So just reaching out specifically to the people who can really make an impact in the local communities you're trying to impact.
Yeah, that makes a lot of good sense. And it kind of ties into the question that I have for each of you. And that's really these calls to action for our patient community. I've always been big about people having to be an active participant in their management in order to optimize their quality of life and to live well with this disease. You can't be a passive bystander and expect to thrive. You just basically survive instead. And that goes for medical management, it goes for wellness, wellness or self-care. And luckily we have support organizations and dedicated individuals like yourselves to help us along the way and to help guide us. So a sincere thank you for that. But in that spirit of being an active participant, how can we as patients help you and support the work that you are doing? And really, we're helping the whole Parkinson's community if we do so. Who wants to start with that one?
I will. I'll start. I would say that how people living with Parkinson's can help organizations is to help the organization build its capacity to do this work. So organizational readiness to take on these different roles that we play every day as organizations and community. Also to, support our work. Volunteer time, donations are always welcomed. We're all, the nonprofit sector is, particularly smaller nonprofits are hit the hardest because a lot of the monies that are given during this time of pandemic is given to frontline staffing. Our services don't stop, services increase, and then, fundraising diminishes, there's a bigger gap. So I would say that, help the organization build readiness and capacity to be able to take on these roles in community, because we're all wearing different hats as leaders to ensure that our community has what they need. Also be a conduit and a facilitator for those opportunities. If you see an opportunity out there, there's nothing that will, keep you from reaching out to another organization to partner on something, even if your mission is a little bit different, to partner on something that can bring together the community to support a bigger mission. So that's kind of what I would say.
I would say a really easy thing for any person to do is to reach out to your local organization and get a supply of brochures or business cards and liberally litter them everywhere you go for services. Make sure that your dermatologist knows that there's a Parkinson's organization that serves this area. I can't tell you how often we get a call from someone in an outlying area that is inquiring about services. And when we let them know there is no boxing class in your town. And the answer is, well, I know of 6 people that would sign up. Well,
Yeah.
that's amazing. But if those 6 people aren't organized or using an entity to help organize them, then it's really six remote individuals. And so any of us can be helping to coalesce a community, either by distributing information, helping funnel people back to a consolidated resource base, or stepping forward as the volunteer to start that group in your own community. Absolutely.
Excellent. Kathleen or
I
Ann?
would say, yeah, I would say to build on both what Wendy and Holly have said, and I'm sure, you know, Amber will also have something kind of associated, is the connection aspect. Let's don't be afraid to connect, whether that's with each other, you know, to each other. I think that, you know, not only individuals with Parkinson's, but care partners as well, all have their, you know, common and then, you know, overlapping and unique needs. But also, you know, don't be afraid to reach out, as Holly said, to the local resources, because even if you've looked at something and go, well, there's nothing really there that I'm interested in, or they have nothing for me. I know, you know, I can speak on behalf of my organization and my team. We thrive on education. We are not an if you build it, they will come kind of organization. So we are looking to guidance, and we're very grassroots, very needs-based, you know, kind of thumb on the community. And so if there's something that you need, help us by educating us. I mean, I think the education piece is so important, because that's where we can really work together. And I think that, you know, just a broad education of Parkinson's, but that also, just the more people that we connect together, the better we can spread the word about Parkinson's and how it affects individuals and how it affects families and how it affects communities. And I think that we know that, you know, timely identification leads to improved quality of life, delay in disability, and hopefully, you know, potentially improve survival. And those are things that, you know, that I think that everyone benefits from, but it has to be collaborative.
Right.
Yeah, I would definitely kind of piggyback off of that, especially what Kathleen kind of said about I could be an expert on the overall resources of what's available on a national, statewide level, but I don't know. I'm not the expert of local communities across Nebraska. You guys are the experts of those communities. Everybody listening today, you're the expert of your own community and your own wellness needs and the wellness needs of people around you that have Parkinson's disease. And really that education goes both ways. We are all here, everybody, you know, on this panel, we're here for the purpose to help and strengthen our communities, but it is collaborative both ways. It does require us to kind of rely on those local communities and leaders to tell us what the needs are so that we can collaborate, find what partners, you know, help you identify the needs, help you identify what partners and, you know, businesses and organizations could help you on that local level. And I would also just like to say, you know, over these last 2 years, we, again, have been really intentional about rural outreach, and we've really seen a lot of success in our rural communities being strengthened, and that has to do with those people at that local level. So I'm here to say that you can make a difference. You can make an impact. You don't have to work for a nonprofit. You don't have to know everything about Parkinson's disease. You really just need to, it starts with forming relationships with other people with Parkinson's, with your service providers, with your doctors, and just know that you really do have the power to make a really big impact on a lot of people's lives, really no matter where you are in your journey. And I hope that's something you can really take away today, that you are super powerful.
That's so cool. Yeah, I agree. Just we're sort of still at the beginning of the new year, and we're all hoping for a better year this year for sure. But just to briefly ask each of you, what sort of makes you excited about the coming year? What in your organization, what particular project or initiative gets you up in the morning and says, yeah, this is going to be fun? Or Wendy, do you want to start?
Yeah, I think that the fact that I can bring my whole self to my role, which is very different because of all of the social justice issues that happened last summer, I can really walk into a space and identify myself as a woman of color, and I have a unique talents, needs, and I can bring my knowledge related to aspects of my community, because I can't speak for my entire community, to my work that wasn't done before. So I get really excited about being able to make a difference with those communities that are often unseen and underrepresented in our region. So the collaboration across all of our centers has been just a phenomenal opportunity for all our docs, all of our providers, for me, for my board, for my community. It's just a really, that's what makes me really excited about my work in 2021. Forget about 2020. Everybody wants to give, the big to 2020, but 2021 is lots of promise, and I'm very excited about that.
Holly?
I think I'm excited about figuring out this hybrid. I think that we are going to be virtual through the summer, and then maybe there'll be slowly some gradual lifting. What I think is going to be important for an organization, for all of our organizations, is to be paying attention to this telemedicine and the digital divide. I think that if virtual is going to continue, and it is, there's kind of no going back, that genie is out of the bottle here. We need to find a way to make sure that that new universe is inclusive from the beginning, so that we're not having the same issues just being replicated with access and access barriers going forward, and we're having the same conversation again.
Makes good sense. Kathleen?
I think, gosh, last year was such a bad year. But having the perspective of someone who's been with the same organization for nearly 20 years, what I saw last year was a lot of change, and the ability to change and the ability to accommodate people's needs. And I think what I'm most excited about is the resilience of the community, the resilience of the Parkinson's community globally, but also just the resilience of our local community, and how much they've given during, and I don't mean monetarily, but I mean how much they've given of themselves to figuring this out and continuing their journey and living proactively with Parkinson's. And that's really exciting. I look forward. We will obviously have a hybrid model going forward, but I look forward to seeing people in person. But we have done over the last year thousands and thousands and thousands and thousands of phone calls with people, and so it was great to strengthen and deepen some of those relationships with people on a very different plane. And I look forward to more of that as well. But I think that in some ways, being apart has brought us together. And so that's something that I find is kind of the spillover excitement for me.
Excellent. Amber?
Yeah, I would definitely kind of echo that. One thing I like to do a lot in my own life and in my role is find the silver lining in everything. If you receive the Parkinson's Nebraska newsletter, you get that line a lot. We always are looking for the silver lining. And as awful as 2020 was for a ton of reasons, it really did. It allowed us to identify different barriers that we're facing. It's allowed us to get into new communities. And so I'm really excited to work towards, meeting these new needs that have been identified, continue to identify new ones, and strategically, or on a bigger scale for our particular organization, we are looking to hire an additional staff member, which will really be great for me personally, obviously, but also for the organization as a whole, because that's really gonna, expand our capacity, like Wendy was saying, to be able to meet these needs. There's only so much, manpower, woman power, behind us. And I'm really looking forward to what, with what we've been able to accomplish over the last few years, what are we going to be able to accomplish with an expanded capacity? And now that we know these new needs and these new barriers, there's a lot. I could talk all day about all the things that we're looking forward to in 2021. But that's going to really help us out.
Well, the hour has flown by, so we're coming to the end of our time together. And I just want to thank you all so much for your insight and your experiences. It was sharing them with us. It was greatly appreciated. I also wanted to thank everyone who tuned in for joining us today. And I hope that you found your time with us helpful and educational. And always remember, you may not have control over your diagnosis, but how you face the challenges that this disease brings is yours to determine. So focus on optimizing your quality of life, educate yourself, empower yourself, and celebrate your daily victories. I'd also like to just thank Dance for PD for partnering with us on this webinar series. Their support is much appreciated, and it's been wonderful to have them involved. So until next time, thank you.
Thank you. Thank you.
Thanks, everyone.
Thank you.